Welcome to Dragonfly Asks. This series is meant to answer the questions that all of us have about mental health, mental illness, and everything in between. Our very first expert is Dr. Ray DePaulo. Ray, can you please introduce yourself?
Sure. I'm a psychiatrist who trained in the early 70s and joined the faculty at Johns Hopkins in mid to late 70s. I've always specialized in depression and bipolar disorder, and I've been very fortunate that I've been able to participate in the care of about, somewhere in the range of 20,000 patients.
So our very first question is one that we get asked at Dragonfly Mental Health all the time, and that's, when is the right time to seek care? Sure.
First thing I want people to know who might present themselves as patients is that none of us, no professionals will be concerned if they're seeking care, a little too early, or if they don't need much care right now. That's happened once or twice in my life out of the 20,000 patients I've seen, but that's the rarest of examples. The most common experience is that patients who really do need care, about half of them feel that they're probably coming too early, or that they're maybe judged by what they answer to questions, or that what other people will think about them having seen a psychiatrist or a therapist. Seeking care early overall is advantageous, especially when you look at the age of onset for most psychiatric conditions is in the middle to late teens and early 20s. And that's such an important time in life that you want your family members or people you love to be at their best in that period of time, say between ages 17 and 27, because so many important things are going to happen. So when do people normally seek care? How sick are they? And what are some of the questions that they're struggling with when they do? The kind of things that they're struggling with in terms of why they're coming in often is that they feel like, well, everybody feels this way, okay, and that I'm not any different than anybody else. Sometimes, and then so that it's often a family member or a loved one or a close friend that says, no, I think it's a good idea for you to seek care. So that sometimes they're persuaded by other people, and thank goodness they're willing to be persuaded, okay? Because there are others that are not so willing. And we know that most people, for example, with clinical depressions are not in care at the time they're going through them. So that even when somebody comes in to tell me, well, I think I have a clinical depression now, and they may give me plenty of good reasons why they think that, typically, I find when I take a complete history, they've actually had 2 or 3 prior episodes already. And so when you're saying that a lot of patients come in later than they should, what do you mean by that? How could they have been better off coming in earlier? Well, there are several, and the first one that comes to many people's mind is the risk to their life and health, obviously. And so suicide is a very important issue. And sadly, it is very strongly associated with the illness of depression and bipolar disorder. Actually, getting into care itself is a protection against suicide. So let's try to break this down just as simply as we possibly can. What are the very, very clear times or signs or symptoms or things that indicate someone should be seeking care? When people get too ill, they actually lose insight. Early on, they might think, well, is this a depression I've got, or is this normal mood? But later, when the depression is so severe and they're judging themselves in such a negative and harsh way, okay, then they believe things like, well, I don't deserve care. It's hopeless. No one could help me. And they're not thinking clearly as they normally would, okay? They might think they're even worse than they are, but in fact they're not operating at the best. They're not able to concentrate. They're not able to focus, and therefore a little discouragement, like making a call and a doctor saying, "Hey, I'm not seeing new patients," or "I don't take patients with that insurance anymore," becomes very discouraging to people, and they literally stop trying. So loss of insight in severe cases of depression and other psychiatric illnesses is very important, because the patient loses the ability to even judge that they're in need of care.
Well, thank you so much, Dr. DePaulo. It has been absolutely incredible speaking with you today, and I cannot wait to have more of Dragonfly Asks Hopkins Psychiatry.
Thank you, Wendy. It's been a pleasure.